But yeah, so in terms of patients, what can patients do to minimize the risk of complications? Well, it's about being fit and healthy. So, trying to maximize your activity, obviously within the pain that you have. If you can get out and be mobile, that improves the blood flow in the legs, reduces the risk of blood clots. Anything you can do to kind of strengthen the muscles around the hip will aid and speed the recovery afterwards. Healthy eating, obviously, having a healthy balanced diet, not smoking. Smoking has a risk for medical complications. Equally, appropriate amounts of alcohol are obviously important as well. And then, engaging with the process. So, listening to the advice that's given. We talked about hip precautions. If you've been told to follow those, then you should follow those. Engage with if you're having physio afterwards, which some places would have, to do those exercises, to not overdo things. So, sometimes we have patients that, feel that are indestructible afterwards, the pain's gone away, and they want to just get out and do everything. So, you see them afterwards, a few weeks after surgery. Oh, yeah, my hip's brilliant. Yeah, I climbed the mountain in the Lake District of the weekend. You think, it's a bit, a little bit early. I kind of tend to focus patients on that first kind of six to 8 weeks of after surgery, in terms of things healing up, particularly if they've uncemented implants used, where the bone has to grow into the implant. If you overdo it, you can get a bit of movement, and that can jeopardize that fixation. So to not overdo it, in that first period, enables good fixation. And then when that's done, then they can just go and do whatever they want. So I say, look, just take it easy, because you can spot the patient who's going to go off and do mad things. Obviously everybody's different. We've already said that, but some people will be just chomping at the bit. So you say, keep it calm for just 8 weeks. Do that for me, and then you can do what you want. And I won't tell you not to do, X, Y, Z, skiing, cycling, triathlon, or whatever it is.
So giving it time to heal, gentle little movements to keep blood flowing and so on, but nothing too extravagant for 8 weeks or so. Yeah.